Here is the surprise. That constant mucus feeling in your throat is often not a chest infection, not just getting older, and not even a huge amount of extra mucus. In many people, the real problem is irritation. Irritation from the nose, irritation from silent reflux, irritation from dry mouth. And once that irritation starts, your throat can feel sticky, full, and impossible to clear, even when there is not much there at all. If you keep clearing your throat all day and nothing really comes up, this video may explain exactly why. Harvard Health Cleveland Clinic. Harvard Health points to postnasal drip as probably the most common cause of chronic throat clearing, and the Cleveland Clinic lists silent reflux, excess mucus, chronic cough, and that something stuck feeling as classic throat symptoms. In other words, if you keep feeling mucus in your throat, the answer may be higher up than you think. It may be your nose, your stomach, your saliva, or even the muscles in your throat reacting to irritation. Harvard Health Cleveland Clinic. And before we go deeper, if this kind of clear, calm health information matters to you, subscribe. It helps this channel reach more people who are worried, confused, and trying to feel better without being scared half to death. And tell me in the comments, how old are you, and where are you watching from? I always love seeing how many people are learning together here. The first cause is postnasal drip. This one fools people all the time. You may think, if mucus were coming from my nose, I would feel it in my nose. Not always. Sometimes the nose drips backward, not forward. Imagine a roof gutter that is not pouring out onto the driveway, but leaking quietly behind the wall. You do not see the water, but the wall keeps getting wet. That is what can happen in the back of your throat. Your nose makes mucus for a reason. Mucus traps dust, germs, and allergens, which are things like pollen, pet dander, or mold that can irritate your body. But when the mucus becomes too thick, or too thin and excessive, it can slide down the back of the throat and sit near the voice box. That creates the exact feeling many people describe as, there is always something there. Cleveland Clinic lists that urge to clear your throat, frequent swallowing, gurgling, hoarseness, and a feeling of mucus draining into the throat as classic signs of postnasal drip. Cleveland Clinic. Here is the part most people miss. Postnasal drip does not always mean you are sick. It can be caused by allergies. It can happen with sinus swelling. It can happen with dry air, weather changes, irritants, infections, and even reflux. The American Academy of Family Physicians says what doctors call upper airway cough syndrome, which includes postnasal drainage and related nose and sinus problems, is the most common cause of chronic cough in adults. Most common, not rare, not unusual, most common. American Family Physician. So what is the fix? First, think thinner and calmer. Thin the mucus. Calm the lining. Drink enough fluid through the day. A simple saline rinse, which is a gentle saltwater wash for the nose, can help clear out sticky mucus. Humid air can help if your home is dry. And if allergies seem to flare it, especially during certain seasons, that is worth discussing with your doctor or pharmacist, because the right nose spray or allergy treatment depends on the cause. The mistake is grabbing random sprays for quick relief and using them too long. Medline Plus warns that some over-the-counter nasal sprays can make stuffiness worse if overused. Medline Plus. Now let's go to the second major cause, and this one shocks a lot of people. Silent reflux. The medical name is laryngopharyngeal reflux, or LPR. That simply means stomach contents travel up high enough to irritate the throat and voice box. And yes, this can happen even if you do not feel classic heartburn. Think of it like a tiny splash from a sink. Your throat is not being flooded, it is being splashed. But the throat is delicate. Much more delicate than the esophagus, which is the food tube connecting your mouth to your stomach. The Cleveland Clinic explains that the throat does not have the same protection against stomach acid that the esophagus has. So even a small amount can create a big sensation. That is why some people keep saying, "I feel mucus," when what they really feel is irritation, swelling, or that sticky coat the body makes in response to repeated splashback. Cleveland Clinic. This is where the title of the video really matters. The actual cause may not be too much mucus. It may be reflux making normal mucus feel thick and ever-present. Cleveland Clinic lists throat clearing, chronic cough, excessive mucus or phlegm, hoarseness, sore throat, and the feeling of something stuck in the throat among common symptoms of LPR. Harvard Health also names laryngopharyngeal reflux as another common cause of throat clearing, even in people who do not have that classic burning chest feeling. Cleveland Clinic, Harvard Health. The common mistake here is assuming no heartburn means no reflux. That is simply not true. Some people get almost all of their reflux symptoms in the throat. So what can you do? Keep meals smaller if you notice big meals make it worse. Do not lie down right after eating. The NHS advises leaving at least 3 hours between your last meal and bedtime if reflux may be part of the problem. Notice your triggers. Coffee, alcohol, mint, chocolate, heavy late meals, and tight waistbands can bother some people. Not everyone. Some people. The goal is not fear. The goal is patterns. NHS inform Cleveland Clinic some patterns. And let me ask you something for the comments. Do you think doctors warn patients enough about silent reflux? Or not nearly enough? I have a feeling half of you will say, no one ever mentioned it, and the other half will say, I learned the hard way. I would really like to hear both sides. The third cause is dry mouth. This one is so overlooked, especially after age 60. When your mouth gets dry, your throat often feels coated. Why? Because saliva is one of your body's natural cleaners. It moistens food, helps swallowing, and washes away particles and germs. When you do not make enough saliva, the small amount of mucus that is normally there can feel thick, sticky, and stringy. It is like trying to rinse a plate with just a few drops of water. Everything clings. Entdoctor Mayo Clinic says hundreds of medicines can cause dry mouth, including many used for blood pressure, depression, anxiety, allergies, congestion, pain, and muscle relaxation. Hundreds. That is not a small detail. And the NIH's Dental Institute, the entdoctor, says medicines for high blood pressure, depression, and bladder control issues are common culprits. Add in mouth breathing, snoring, dehydration, and some health conditions, and suddenly a lot of older adults are walking around feeling like something is stuck in the throat, when the real issue is not extra mucus. It is not enough moisture. Mayo Clinic entdoctor, the mistake is thinking dry mouth is just a normal part of aging. Entdoctor says dry mouth is not a normal part of aging. It is a sign to investigate, and when you do not make enough saliva, you may also notice trouble chewing, swallowing, or speaking, bad breath, a sore throat, or thick, stringy spit. Mayo Clinic and entdoctor both describe those signs very clearly. Mayo Clinic entdoctor. The fix starts with a medication review. Not by stopping anything on your own. Never do that. But by asking your doctor or pharmacist, could any of my medications be drying me out? Then support your mouth and throat. Sip water through the day. Use a humidifier at night if your room is dry. Try sugar-free gum or sugar-free candy if it is safe for you, because chewing can help stimulate saliva. And if nasal blockage is forcing you to sleep with your mouth open, that loops right back to the nose problem we talked about earlier. One issue can feed another. entdoctor Mayo Clinic. The fourth cause is the one that becomes a habit. Chronic throat clearing itself. Yes, the thing you do to solve the feeling can become part of what keeps the feeling going. Picture rubbing the same patch of skin all day. At first you rub because it itches. But after a while, the rubbing creates more irritation, and now it itches even more. Throat clearing can work the same way. Harvard Health warns that throat clearing can become a cycle. You feel something, you clear your throat. That slams the vocal cords together. The lining gets irritated. Now the throat feels even more raw, and you clear it again. Harvard Health NHS Inform gives a simple piece of advice that sounds almost too easy, but it matters. Try not to keep clearing your throat. Sip water instead. That small switch can break the cycle for some people. Swallowing gently is often less irritating than that hard, explosive ahem. Think of your throat as a bruised knee. You do not keep knocking it to see if it still hurts. You protect it while it calms down. NHS Inform. This is a good place for a real-life example. Let me tell you about Elaine. Elaine is 72. She was not scared of cancer at first. She was annoyed. Every afternoon, she kept making that little throat noise. Ahem, ahem, during church, during phone calls, during dinner. She kept saying, "There is glue in my throat." She had no fever, no chest congestion, no obvious cold. She had allergies in spring, some late-night snacking, and a blood pressure medicine list long enough to fill half a page. What changed for Elaine was not one miracle cure. It was connecting the dots. She started rinsing her nose with saline during allergy season. She stopped lying down right after her evening snack. She began keeping water nearby and replaced hard throat clearing with a sip and swallow habit. Then she asked her doctor to review her medications because her mouth was dry all the time, especially in the morning. Over time, Not overnight. Over time, the constant mucus feeling eased. Not magic, not perfection, but improvement. That is the honest kind of hope people need. If that sounds familiar, tell me in the comments. Have you ever been told, it's probably just postnasal drip, but no one explained what was actually causing the drip in the first place? I think a lot of you have. The fifth cause is allergies and irritants. Not just pollen, not just dust. I mean the whole group of things that make the lining of the nose and throat angry. Smoke, strong perfumes, cleaning fumes, dry winter air, cold air. Even repeated exposure to things that seem small can keep the nose producing mucus or keep the throat inflamed. Think of your throat like a smoke detector. Some detectors are more sensitive than others. A little toast burning in the kitchen, and the whole alarm goes off. In the same way, some throats react strongly to triggers that other people barely notice. The result is that feeling of coating, throat clearing, maybe a little cough, maybe a rough voice, and the strong belief that something is sitting there. Cleveland Clinic notes that postnasal drip can come from allergies, infections, medications, GERD, and other irritants. Medline Plus also points to hay fever, which is another name for seasonal allergies, as a common cause of congestion and drainage. So if your throat is worse in spring, worse after yard work, worse around dust, worse in a heavily scented room, your body may be giving you the clue. Cleveland Clinic Medline Plus. The mistake is chasing the throat and ignoring the trigger. The fix is pattern hunting. Notice where you are, what you were around, what you ate, when it happens, and whether it is worse in one season or one room. Showering after pollen exposure may help some people. Keeping indoor air less dry may help some people. Reducing smoke and fragrance exposure may help some people. And if allergy symptoms are strong, getting the right diagnosis matters, because different sprays and medicines do different jobs. Now the sixth cause is one many people worry about the most, because it feels so strange. Globus sensation. That is the medical term for feeling like there is a lump, pressure, or something stuck in the throat when there is not an actual blockage. Cleveland Clinic and NHS Inform both describe it this way. NHS Inform says people may feel mucus they cannot clear, tightness, pressure, or a lump, and symptoms often get worse with stress and worry. Cleveland Clinic NHS Inform SIM. This matters because sometimes what you call mucus is actually muscle tension plus irritation. The throat muscles tighten. The area gets more sensitive. You keep checking it by swallowing or clearing. The brain notices it more and more. It becomes a spotlight. And once the brain puts a spotlight on a body sensation, it can feel bigger than it is. That does not mean it is all in your head. It means the nerves and muscles are involved, which is very real. The common mistake is panic. The second common mistake is going the other way and ignoring everything forever. The truthful middle ground is this. Globus is usually not serious. Usually. NHS Inform says if you can eat and drink normally without pain, you do not need to panic. But if you develop trouble swallowing, pain when swallowing, unintentional weight loss, or a lump in the neck, you should get checked. Those are not symptoms to brush off. NHS Inform Salage. And I want to pause here for another comment debate, because this one always divides people. Do you think stress can show up in the throat more than most people realize? Or do you think stress gets blamed too often, and real physical causes get missed? Tell me what you think. I know some of you will strongly disagree with each other on this one. There is one more hidden cause that deserves a brief mention. Medications that directly trigger throat symptoms even when they are not causing obvious dry mouth. Harvard Health points out that ACE inhibitors, which are a class of blood pressure medicines, can lead to frequent throat clearing in some people. So if your symptoms started after a medicine change, or they slowly appeared while your medication list grew over the years, bring that timeline to your doctor. Timing matters. Harvard Health. So what should you actually do starting today? Keep it simple. First, ask yourself whether this feels more like drainage, reflux, dryness, irritation, or tightness. Second, stop attacking the symptom blindly. Do not keep pounding your throat with constant clearing. Third, start a small tracking habit for 1 week. When is it worse? Morning, after meals, at bedtime, outdoors, during allergy season, after coffee, after talking a lot? Those clues are gold. They turn a mystery into a pattern. And if you wake up with it, that pattern matters too. Morning symptoms can point toward mouth breathing, dry air, snoring, or nighttime reflux. Symptoms after meals can point toward reflux. Seasonal patterns can point toward allergies. Symptoms during long conversations can point toward throat irritation and clearing habits. The throat tells stories. You just have to listen carefully. Let's recap, because repetition helps memory, and memory matters. First, postnasal drip. Mucus may be dripping backward, not forward, and it can happen from allergies, sinus swelling, infection, dry air, or other irritation. Thin the mucus and calm the nose. Second, silent reflux. You may not feel heartburn, but tiny amounts of stomach contents can irritate the throat and create that constant sticky feeling. Smaller meals, not lying down after eating, and noticing triggers can help. Third, dry mouth. Hundreds of medicines and several common problems can reduce saliva. When saliva drops, normal mucus feels thicker. Moisture matters. Saliva matters. Fourth, habitual throat clearing. The very thing that feels relieving for 1 second may keep the throat inflamed for hours. Swap the hard ahem for a sip of water and a gentle swallow when you can. Fifth, allergies and irritants. Pollen, dust, smoke, fragrances, dry air, and cold air can keep the nose and throat irritated. Do not just chase the mucus. Look for the trigger. Sixth, globus sensation and throat tension. Sometimes the feeling is real, but it is not a true blockage. It is irritation, tight muscles, and a sensitized throat, creating the feeling of something stuck. And here is the big truth, tying all of this together. What feels like one problem, I have mucus in my throat, is often several small problems working together. A little allergy drainage, a little nighttime reflux, a dry mouth from medications, a throat clearing habit that keeps the whole thing alive. That is why random remedies often fail. But targeted changes can help. Now, a brief safety note, because this is important. Talk to your doctor before making major changes, especially if you take medication or have a diagnosed condition. Natural does not always mean risk-free, and this video is for educational purposes only. Also, do not ignore red flags. Get medical advice if you have trouble swallowing, pain with swallowing, a lump in the neck, unintentional weight loss, symptoms that keep going, or hoarseness that does not improve. Those deserve proper evaluation. NHS inform Harvard Health. If this video helped you understand what may really be behind that constant mucus feeling, subscribe now. It helps this channel reach more older adults who are tired of vague answers and want clear, honest explanations. And before you go, tell me in the comments, what seems to trigger your throat symptoms the most? Meals, mornings, allergies, dry mouth, or stress? Your answer may help someone else reading along. And keep watching, because in the next video, I'm going to show you the subtle signs that your acid reflux may actually be damaging your